What is fact and what is fiction? It's becoming more difficult to distinguish one from the other in the context of an international health emergency. Malan, a seasoned journalist and executive director of the online news platform Bhekisisa, is here to try and help us answer this question. How do you tell the difference between fact and fiction? Where should...
So the way that has always worked the best for me as a journalist over the years is to get the opinion of a scientist and perhaps more than one. And I think that's very important with the new coronavirus because the peer-reviewed process for research has largely been skipped with this virus because we need to move so quickly. And if you have something peer-reviewed, it could take many months to get something published in a journal. So what we have at the moment is a lot of preprint studies being published, and it means the methodology has not been scrutinized by other people or other scientists, and it opens it up for a lot of wrong findings, essentially. We now have all reporters reporting on it. And that means it's not just necessarily people with a scientific background as journalists, and it opens up the opportunities for mistakes. And I will tell you a story that we made a mistake with. So when we did our first coronavirus story in South Africa, we interviewed a very high-ranking health department official on the coronavirus team who told us we don't need to be very concerned initially about it because it was summer when this virus landed here, and the virus doesn't like heat and it doesn't spread in countries where there's a hot temperature, which is not true. We quoted her and we got taken on by scientists on social media, and we then went to look at the studies, which is what you should do, and we learned that it's inconclusive evidence, and we then adjusted the story.
Why do you think that people would rather turn to something that isn't necessarily credible but is a little bit more believable?
So lots of studies have been done on why does fake news spread much faster than correct news, and it's often because the fake thing that is being promoted sounds like a miracle solution or something that's easier. And that is one of the valid reasons why fake news spreads faster. It's also a lot more harder to stop that fake news. It's harder to do stories that dispels those things than it is to do just a tweet to promote those things.
So how do we then say, okay, fine, this is a good source or a bad source? Where should we be getting our news from?
So I think it depends on which country you are. So I'm going to talk about South Africa. I think when it comes to figures, you really shouldn't listen to any new cases or confirmed cases that is not sourced from the National Institute for Communicable Diseases. That's where our official figures come from. In South Africa, we're relatively fortunate because our government has a very much of an evidence-based response. It has a committee of 50 scientists that the president really listens to and takes their advice on board. So we have quite credible government information that's being released in terms of new cases and what to do. In a country like, say, the United States, it's harder because there's a president that doubts a lot of the science around the new coronavirus, and that also means that reporting will be different. That reporting focuses very much on the politics of the president denying these things as opposed to what people should do.